Hi, I am Dr. Naveen Tahsildar. I am spine surgeon working at Narayana Orthopedic Spine and Trauma Care Center. We're going to talk about a procedure called as vertebral column resection. This particular surgery is usually done as a measure for severe deformities in the spine, or sometimes it can be done for infections in the spine. Sometimes it can also be indicated in tumors of the spine where you want to remove the entire tissue and create some space there. Vertebral column resection is a challenging surgery because there is a lot of blood loss involved, there is a lot of expertise involved in the surgery, and this surgery basically means that you are removing either one vertebral bone entirely or two or three vertebral bones entirely, and where we remove the bone, we are going to reconstruct it with either a metal cage or a bone like the ribs or the fibula, another bone, to basically reconstruct the spine. And we also fix the spine with screw and rod to stabilize the spine. This surgery, when it is done for severe deformities, can give us a very good correction of the spine. Severe deformities can be made straight, especially in a condition called as ankylosing spondylitis, or for that matter, a severe scoliosis or a severe kyphotic deformities. And when this surgery is done under neuromonitoring with strict measures to monitor the spinal cord, the results are good, and these patients usually require a prolonged 6 or 7 days hospitalization. And we've been doing this procedure regularly for severe deformities and also for the tumors, and we've been having good results.